Okay, welcome everybody to today's webinar, which is called Using Geospatial Data to End the Global Sanitation Crisis. So unfortunately, Lindsay Noakes, co-founder of Gaither, was unable to present today's webinar as originally planned due to various different reasons around current circumstances. However, in her place, we've been joined by John Peter Archer, who is also the co-founder along with Lindsay at Gaither back in 2016. So it's brilliant to have the second co-founder involved. So John Peter oversees Gaither's Thought Leadership Programme, fundraising and various different partnerships. So previous to Gaither, John Peter co-founded Health and Hope UK, which provides primary healthcare and community support in northwest Myanmar. So it's a pleasure to have you present this webinar, so thank you for stepping in. As always, there'll be time for a Q&A session after the presentation, so do submit your questions in the Q&A option at the bottom of the screen. You should be able to see that as a little white box, and you can submit them at any point during the webinar, and these will be asked on your behalf at the end. So thank you all for logging in, and I'll now hand over to John.
Great, thank you, and thanks everyone for joining today. It's a real privilege to join with you. Lindsay sends her apologies, but all of the team, thank you for joining us. We always love opportunities to share our work and to receive questions and critical feedback on what we're doing. So this is a really great opportunity for us. Before I begin, I just want to give a quick outline of what we'll be focusing on. So first off, I want to introduce our team, then give an overview of the current global sanitation crisis, give some definition around the sanitation data gap, and then share some of the insights and challenges that we have found in our most recent work in Antananarivo in Madagascar. So this is our team: myself, Lindsay, Levan, Nicholas, Rahima, and Indigo. We are based in London in the UK and in Antananarivo in Madagascar. We're joined as well by a team of expert advisors from organisations including Google, UNICEF and the World Bank. Sorry, not the World Bank, the World Health Organization. And then also a board of trustees who oversee our work. We are a registered charity here in the UK, and we're in the process of registering in Madagascar as well. So our mission is quite simple. We help decision makers know where and how to improve sanitation infrastructure and services for low-income communities. By 2025, we want to have helped transform sanitation for 5 million people living in 4 emerging cities around the world. And we do this in 4 broad different ways. We're really big, strong believers in citywide collaboration. That's bringing together all of the relevant stakeholders and decision makers for sanitation in one city. We believe in the power of geospatial analysis to be able to find more insight from the data. We are big supporters of global data standards so that data can be shared more easily among different organizations. And we're really keen that the work we do doesn't just generate insight, but turns that insight into action. At the end of the day, for us, we're not satisfied with just providing more data and more insight. We want to see that be turned into better and improved infrastructure and services for low-income communities. So to explain a bit about the global sanitation crisis. So every year the crisis results in increased healthcare costs, decreased income and reduced productivity totaling more than $200 billion. This is because without toilets, children can't go to school because they get sick. Girls, when they start their periods, also can't access education. Households are prevented from being able to work, and entire communities become dangerously polluted. And when we talk about sanitation, it's important to note that we're not just talking about toilets. In the context that we work in, we are looking at the entire sanitation value chain. Oftentimes, the sanitation provided in these contexts are not linked to sewers because of the lack of space or the lack of investment. And so we're looking at on-site solutions such as pit latrines, septic tanks, or container-based toilets. And the sanitation value chain, as shown in the graphic on the screen, goes from containment to emptying, to transport, to treatment, and to reuse. And when we talk about the sanitation data gap, it's important just to set the context again. So Sustainable Development Goal 6.2 aims to have universal access to sanitation for everyone in the world. In the last decade, a lot of work has been done to overcome the unique challenges of providing sanitation in informal settlements. The key challenges being the lack of space, ensuring that there is access for collection trucks, and also reducing the amount of water needed to both operate and clean the toilets. At the same time, both the United Nations and the World Bank have released report after report that states that the lack of effective, actionable data means that sanitation sector cannot build momentum and get enough sanitation to everyone who needs it. When we launched in 2016, we spent a good year interviewing over 100 decision makers from across the sanitation sector, from municipal officials to sanitation providers, to regulators, to academics, and to funders and investors. What we found surprising is that everyone was saying the same thing, that although they felt that they were collecting more data than ever before, there seemed to be a severe lack of data that they could actually turn into action. And we found this to be true through our research, that everyone was collecting a lot of data, but it tended to be siloed, it was scattered, and often it was in a format that could not be shared. As a result, we found that multiple organizations were collecting the same data. There was a lot of overlap, there was a lot of repeated data collections. But then because of the ununiform way it was being collected, it was then really difficult to verify the data and use it as a baseline. So when we talk about the sanitation data gap, we've tried to zoom in as much as possible. And we're referring to data that is missing that would otherwise help us to quantify, localize, and enhance our understanding of the current state of sanitation value chain in a city. So the missing data is needed to understand which areas to prioritize for investment into infrastructure and services based on the risk to the local population of the fecal contamination of water. Excuse me. And then it's important as well just to state our overall goal. So as I said, we're not interested in just creating data for data's sake, but what we're working on is creating a new sanitation index that allows organizations to understand the analysis of sanitation data alongside other contextual data sets, such as population density, proximity to road network, topography, and flood risk. We believe that this will allow us to create a shared geospatial baseline, measure the risk of fecal contamination, and then identify the priority areas for investment and track this over time. The examples that are on the screen now are from a project that was run by a good partner of ours in Lusaka in Zambia. So the partner collected data on sanitation infrastructure and services and shared this with the municipality, and they used it to prioritize the emptying of pits, latrines, and septic tanks before flooding hit. And in the aftermath of the flooding, they found that they'd helped to reduce the rate of cholera among the local population, which is obviously fantastic and is a really good demonstration of how data can be used to end the global sanitation crisis. This partner then shared the data with us so that we could explore what other insight could be found, different ways that we'd be able to present it, both in graphs, but also geospatially. But when we wanted to take this work further, we came across three different challenges. So the first is that there is no inventory of publicly available or private urban sanitation data. The second is the lack of agreement on what the data standard for the collection, storage, and management of sanitation data should be, therefore preventing its being shared. And then finally, there not being a common way of analyzing this data geospatially so that it can be used as a baseline. So in response, we have tailored our projects as much as possible to try and overcome these challenges and to try and bridge the sanitation data gap. And so first of all, we are building city sanitation data hubs. So this is how we bring together multiple sanitation organizations from one city and work on transforming their data behaviors from the collection, sharing, and analysis of the data so that the city can have one baseline and work together to raise investment from international donors and investors. Over time, we believe that transforming the data behaviors will achieve a near live update on infrastructure and services, and that this will be much more informative and significantly cheaper than the current one-off data collections that are often collected in isolation and only cover a portion of the city. The second project that we are looking at is the Centre for Sanitation Analytics. So this is just a catch-all term for the work that we do, looking at the creation of the data standard, looking at the assessment of current data, and also looking at how we build a sanitation index that is really useful for decision makers to be able to make quick and easy decisions. And finally, our latest project is in partnership with the Benchmark Initiative, and we're looking at the ethics of location data for sanitation. So specifically what we are doing is we're looking at the availability, accessibility, and accuracy of sanitation data for the 50 countries that are currently at the end of the United Nations Human Development Index. So that's a very quick overview of everything that we're doing and the context within which we're working. And what I'll do now is explain how this applies to our work in Antananarivo in Madagascar. So Antananarivo is a fantastic city. It is vibrant, it is diverse, it is dynamic, but at the moment it ranks 172nd for sanitation out of 180 countries. Poorly managed sanitation has a negative impact on the population's health, happiness and dignity, but it's also having a huge impact on the economy. Current research suggests that Madagascar's economy loses nearly 600 million every year from lost productivity and increased health costs due to sanitation-related diseases. To put that in context, that is more than the total sum of investment in Madagascar in the last 10 years. And this is significantly a problem for a country that is listed at 162 on the United Nations Human Development Index. Antananarivo's population is estimated to be 1.6 million people, but the city is prone to flooding due to hillside developments and a lack of drainage infrastructure. In Antananarivo, the rate of urbanization is twice the global average, and 2/3 of the people live in informal settlements. Only 12% of people have access to improved sanitation facilities, and when the city floods, surface water becomes quickly contaminated with fecal waste. Nationally, at least 1/4 of all deaths of children under 5 in the urban areas are caused by water-related diseases. And we believe that actually if we can transform the sector, help to build safely managed sanitation, then we can see a transformation and help people lead healthy, dignified lives and really see cities like Antananarivo thrive. Despite pioneering new solutions to the sanitation crisis, the Malagasy sanitation sector has struggled to collect consistent and robust data, and this has limited its ability to make effective investments and address population risks. The current data and data sharing mechanisms on urban sanitation in particular are very limited and therefore have prohibited evidence-based decision making. So that's the city that we are focused in and working on, and now we'll share some of the work that we've been doing. So the first has been looking into the availability, accessibility and accuracy of the data. We've applied the methodology that we developed with Benchmark, and we've applied this to 3 categories of sanitation data. We are looking at environmental data, social data, and sanitation value chain data. The slide in front of you shows the questions that we are asking for each of the questions of availability, accessibility, and accuracy. And we've tailored and weighted these to really have in mind the decision makers that we are working with. Often data skills are low, data literacy is low. And so what we're interested in understanding is how can we make data sets more available, more accessible, and more accurate for the decision makers in country, rather than them having to rely on external support. When we applied these questions to publicly available data, we restricted ourselves to look at data sets that were at the national level. This is so that we can make country comparisons in the future. And the graphs in front of you show the results for each category of data: for environment, for social, for the sanitation value chain, and then the final graph, graph number 4, which is for overall publicly available sanitation data. And the key insights from the work that we've done has shown that overall availability is about average, accessibility is good, but the accuracy is poor. And this obviously will have a massive impact on the type of decisions that our decision makers are able to make. There's a common trend across each category that accessibility scores the highest and the accuracy scores the lowest. We can see in graph 1 that the environment data scores the highest for accuracy, and this is because it's the most detailed data for a study area on the national level. We can also see for the social data in graph 2 that it scores the highest for availability and accessibility. Environment data is close to this, but sometimes the data that we found is in a complicated format that requires the user to be able to access specific mapping software. For example, the data set that we found on global flood risk, you either need to be able to use the Google Earth Engine or have some basic skills in JavaScript to navigate the data. Unsurprisingly, sanitation value chain data scored the lowest for both availability, accessibility, and accuracy. When we were looking for location data for the 5 stages of the sanitation value chain, we could only find data on the location of toilets. The accuracy score was particularly low, and this is because oftentimes when data on toilets is published, actually the data is on water points and not on sanitation. So this creates both noisy data, but very inaccurate data as well. An obvious limitation of this approach is that it only looks at publicly available sanitation data and doesn't include any data that might be privately held. We're really grateful to the World Bank's Urban Disaster Risk Management, Resilience and Land Global Practice for helping us understand what other data sets are available and for helping us to access them. After some initial analysis of this data, we have been able to create a new traffic light assessment for the data gap for Antananarivo. So our first step was to itemize all of the sanitation data that we thought we would need to bridge the gap as we had previously defined it, looking at how do we identify the areas that are most at risk of the fecal contamination of water, and therefore how and where do we need to be investing in infrastructure and services. So our next step was then to measure this data and assess the overall data gap. What you can now see on the slide is how we have arranged this. So each cell represents a different data set, moving from the kind of default value where we don't know if the data set exists to the most preferred value where the data is ready for use in analysis, both by us, but also by the decision makers that we're working with in Antananarivo. So when we perform this assessment, the data gap is most pronounced when we just look at the publicly available data. But as we start to bring in the private data, both from the World Bank and from other organizations, we're able to start to close this gap. As you can see, again, it wasn't entirely surprising, but the current data gap is most pronounced for the sanitation value chain, particularly for the transportation and treatment stages of the chain. Also, we can see that the current data gap is most likely to be, is going to be most difficult to overcome for social data because of where we expect there to be a lack of private data on the different data sets that we're needing. However, we think the most important one is population density, and that we have been able to find in a few different sources. The current data gap for environment data is the smallest, with most of the data ready for use for future analysis. Which is particularly reassuring for us because it allows us to start to build the geospatial framework to build the index. As you can see, we have both what the current data gap is for Antananarivo, but also where we think the overall data gap will be once we have accessed more private data. And this is going to be some of the work that we as an organization look at undertaking for the rest of this year, working with the World Bank, working with the municipality in Antananarivo, and working with other sanitation providers. I think some of the key things that we found is that we can't just rely on publicly available data. And if the sector wants to have more informed decisions, then there's going to have to be a more local and global conversation on how private data can be made more available and assessed to understand how it closes the data gap. Some key next steps for us are going to be identifying organizations that can make their private data available, and then also finding organizations that are prepared to collect data in a new standardized way so that it can be shared and assessed across the entire city. Another key challenge for us has actually been that a lot of the data sets we have found, when it says in the description that there is location data contained within the data set, it's been very difficult to actually find that location data. It has not been included in GPS or similar structures. So we're having to now do a lot of work at restructuring both existing publicly available and private data sets so that we can include them in our geospatial analysis. How are we going to do all of this? I've just mentioned some of the partnerships that we have. So in Madagascar, we're really fortunate to be piloting our first data hub with the municipality, with two fantastic sanitation organisations, and with the utility company as well that is responsible for providing sanitation. Collaboration is one of our core values. As an organisation, we have benefited massively from partnering with different individuals and organisations with skill sets, insight and experience outside of our own. And this has been really helpful in shaping and improving the quality of the work that we have been able to deliver. Looking forward, we're going to be starting the process of data standardization and hope that will have some initial insights by the end of June. And then finally, by September, we want to be launching the first iteration of our index. And that will include geospatial visualizations showing both the current state of sanitation in the 5th arrondissement of Antananarivo, but also looking at how and where we should be prioritizing investment into infrastructure and services. Thank you so much for listening and for learning about our work. We'd be very happy to answer any questions that anyone has. And if anyone at any point wants to find out more information about the work that we're doing, the website is now on the screen.
Brilliant, thank you. That was really interesting. Some really alarming statistics in there as well. But thank you for sharing that. And if anyone does have any questions, use the Q&A box at the bottom to submit these and I'll ask them on your behalf. Just while we're waiting for a couple to come in, I've got a question around you mentioned the working with ethics of sanitation data. What sort of challenges have you faced around kind of collecting and working alongside that project and that type of area?
Yeah, that's a really good question. So we haven't been collecting data firsthand, and that has both been helpful in that we have just been able to see what data is out there, but obviously makes it challenging when it comes to validating any of the data that we are collecting, so we don't have any ground truth data to compare it against. One of the things that we have used to guide our work has been the Open Data Institute's Data Ethics Canvas. It's a really helpful tool that asks about 15 different questions or sets of questions that you can ask at any point of any data project. You could ask it at the very beginning as you're designing, halfway through as you're reviewing, or at the end as you're wrapping up. We've used it to really try and understand how do we make our results as accessible as possible. So one of the outputs of the benchmark project will be an online tool that will allow users from the 50 countries that we are investigating to be able to access that data and understand both what the availability, accessibility and accuracy is at the moment, but also what the next steps would be required to take that forward. So one of the ongoing conversations as a team is looking at that canvas and saying, are we considering any negative implications of the work that we're doing? Have we considered any harm that could happen? One thing that we've decided not to do is create a ranking among the 50 countries. The goal of that project isn't to name and shame either countries or organizations that are not doing a good job. The aim of the project is really to further the conversation about how we need to make sanitation data more available, accessible and accurate. And we recognize that a lot of the countries that we're looking at have weak systems for collecting and sharing data that is not necessarily their fault. And that actually one of the things we want to do is bring multiple stakeholders in to say, how can we all share this data burden, rather than just expecting both local, municipal and national governments to take lead by themselves. So that's one of the decisions that we made quite early on, is we're not going to rank countries, but instead we're going to try and present the information and assess the information in a way that gives, helps to further that the conversation overall.
Sure, no, that makes perfect sense, and I guess an opportunity for other countries to kind of apply lessons learned and things like that. One question has come in just asking about whether your team or similar have done any work around this in the UK, because we obviously do have the data here, and we do have sanitation issues like the release of organic wastes during flooding and things like that. Yeah,
so we have sometimes looked at some case studies in the UK. We haven't specifically looked at any active projects in the UK, partly because our charitable constitution focuses on countries around the world as opposed to the UK, but we have definitely, where possible, tried to build partnerships and learn from other individuals to see what they're doing. there's definitely the joint monitoring program that was set up by the World Health Organization and UNICEF to monitor global sanitation is monitoring sanitation in the UK as well. And that's often the treatment and reuse of waste is the key challenge for the UK. At the moment, we don't have capacity to look at that challenge and that issue, but it is something that we are keenly aware of and interested in.
Sure, okay, thank you. Another question, is there transferability to other geospatial applications?
By that question, do you mean in terms of looking at other sectors like other sectors outside of sanitation?
Yeah, I think so, and yeah, other sectors and across kind of the specialisms really.
We hope so. So we are trying at the moment just to focus in on sanitation, and then water is linked in with that within Sustainable Development Goal 6. But we're aware as well that the work that we're doing, both in terms of how we build partnerships, but also looking at some of the challenges in urban contexts, definitely has a possibility of replicating that when potentially looking at energy or looking at housing or some of the other challenges that these urban centres are facing. So one of the things that we do try and do, we share our insights both within the sanitation sector, but we do try and contribute to other events that look at data more broadly and geospatial data more broadly, just to see what we can learn from those sectors, but also so that we can share the work that we are doing. We try to be as open as possible about our methodologies and both our successes and our challenges and our failures as well, so that other people can, we hope, take them up and apply them in their work. So yeah, we would, I think for us, we're focused on sanitation for these 5 years, but if people are able to take the work we're doing and apply it to similar sectors or other completely different sectors, we think it is possible. And from the initial conversations we've had with people, we think it is possible. We just, again, we don't have the capacity, unfortunately, to do that ourselves.
Sure, no, I do appreciate that. And what sort of software, GIS software are you using currently? Are you using ArcGIS or QGIS or anything similar?
Yes, so our team have used both at different points. We're really grateful to ArcGIS that we've got a reduced subscription for this year, thanks to our charity status. So our team, Leven and Indigo in particular, have been using that. In the past, we've used QGIS as well. Some of the data, we process it through R. We're looking at a few different ways of processing it through Python as well. But the majority of the geospatial work at the moment is through ArcGIS.
Okay, brilliant, thank you. I know that's a platform that an awful lot of our membership use currently for various different areas. Have you done anything or plan to do any work around disaster relief in kind of focus of sanitation within refugee camps or similar?
No, we haven't, but it's something that we're acutely aware of. So some of our previous partners in other countries that we've worked in do work in internally displaced camps or in refugee camps as well. We've had conversations with organisations who've been working out in Cox's Bazar in Bangladesh, looking at the refugee crisis there. We haven't played an active role in any of those projects, but what we've tried to do is make links with different project partners that we've had or different organisations that have lent us support. We've tried to then link those up with first responders and disaster relief organisations. Again, it's been from a capacity side that we've not been able to play an active role in those. Oftentimes it requires on the ground presence as well to be able to collect some of the ground truth data and to be able to do some of the training to kind of keep the mapping going. So in our kind of response has been trying to connect people as much as possible when we've come across organisations that we felt would be able to work together on particular challenges. We are aware that obviously some refugee camps have been in existence for a while and that they are in many ways small cities. And so we have had a few early conversations with organisations there to see how we could apply our mapping work just so that we're able to provide some more insight into what is needed in those contexts. The other thing that we have explored is looking at, once we have created our first index, it will obviously show the hotspots for where fecal contamination of water is highest by introducing the flooding risk data with that as well. We'll be able to hopefully start to do some predictive models. So a lot of the cities that we're working in have annual flooding challenges, and that leads to annual outbreaks of cholera and similar diseases. So for the time being, that's what we'll be focusing on, trying to help our project partners and the municipalities tackle those and invest in a way that prevents that from happening in future years. And then from there, we'll try to apply it to other disaster scenarios. Yeah, that's what we're focused on at the moment.
Okay, brilliant. That sounds really interesting. Another question that we've had as well. What are some of the key challenges that you've experienced apart from data collection in Madagascar? And do you feel that there is a platform to educate locals first and the importance of this?
Yeah, so I think some of our challenges, what have been some of our challenges? I mean, we enjoy some really good partnerships with the local organisations, which has been fantastic for the design process and to make sure that we are doing and building things that are useful for decision makers. We're very aware that as a charity, we are slightly unusual in that we don't work with what you could kind of describe as traditional beneficiaries, but we're working with other nonprofits and other organisations that are also trying to tackle the sanitation crisis. In the past, we did look at providing data collection tools for local people, or we looked at providing tools that allow local people to request pit emptying services and that kind of thing. What we quickly found by just meeting with organisations that have done similar things, that the lack of infrastructure or the lack of ecosystem, probably a better word, in terms of the data that was available and sharing data among different organizations, meant that you could create that app quite quickly and that people would start to use it, but then there would be a disconnect between actually requesting a pit to be emptied and that pit becoming emptied. Or there'd be mapping initiatives and the mapping would happen in a particular informal settlement and it would be comprehensive, but then that data wasn't used by any organizations. So what we're trying to do through our city data hubs is link things up a bit more strategically, so that when those kind of exercises happen in the future, local people then see that there is a direct result from engaging with them, rather than engaging and nothing happening and it kind of creating a sense of distrust or lack of engagement with it. So that's kind of some of what we have explored and are keen to explore again when the ecosystem is ready. But we, again, the kind of partners that we work with, we always look to partner with organisations that very much put people front and centre, that have people, local people involved in the decision-making process, and have a good and equitable representation of local and particularly vulnerable people, whether it be in their community groups or customer groups as well, as a way of ensuring that what we're doing is helping to help the most vulnerable in the community.
Okay, thank you. I think this might have to be our final question, but I've had one more come in that it's more of an interest really to kind of see if you have explored this type of area or started conversations in this area. That is of interest, that looking at interactions between population data and demand and combining with infrastructure gaps and hydrogeological geospatial models to identify drinking water sources. And whether there's a possibility to kind of join up with existing water charities like WaterAid. Is this an area that you've explored or looked into before?
So it's an area that we're starting to explore. So it will be, they're the kind of questions that we'll be exploring with the different decision makers to understand what they are needing and wanting through the index and through the analysis. We're keen to join up the data as much as possible. We've had a few conversations with other organisations that have done similar kind of work of linking up demand and population and flooding risk, etc. So yeah, it's something that we're really interested in, and if anyone has any examples or ideas or suggestions of how to go about that, we would yeah, love to hear.
Okay, brilliant. And I assume contact details for that kind of thing would be through following the link on the website that you've just shared with us. Is that right?
Yes. Yeah, or can email me directly at john@gatherhub.org.
Okay, fantastic. Thank you. I think that has kind of brought us to a close on that. We've covered all the questions that have been submitted. If there are any more that come in, I will ask them or share them with you.
Great.
just to thank you again for presenting. That was really interesting. I know you stepped in at last minute, but that was, yeah, really good insight into the work that you're currently doing and some of the challenges and opportunities that are coming out of it. So thank you for joining us today.
My pleasure.